Hello everybody. Today I will talk about two presenting problems of the gastrointestinal system, dysphagia and dyspepsia. Let's start with dysphagia. Dysphagia is one of the presenting problems in the gastrointestinal system. Dysphagia is defined as difficulty in swallowing. It may coexist with heartburn or vomiting, but should be distinguished from both globus sensation and odinophagia. What is odinophagia? Odinophagia is pain during swallowing, usually from the gastroesophageal reflux or candidiasis. Dysphagia can occur due to problems in the oropharynx or esophagus. Let's start with the oropharyngeal disorders. These disorders affect the initiation of swallowing at the pharynx and the upper esophageal sphincter. The patient has difficulty initiating swallowing and complains of 1. Choking, 2. Nasal regurgitation, 3. Tracheal aspiration. Note that drooling, which is running of saliva from the mouth, dysarthria, which is difficulty in articulating words, hoarseness and cranial nerve, or other neurological signs may be present. Now, esophageal disorders. These cause dysphagia by obstructing the lumen or by affecting motility. Patients with esophageal disease complain of food stucking after swallowing, although the level at which this is felt correlates poorly with the true site of obstruction. What are the investigations for dysphagia? Endoscopy is the investigation of choice for dysphagia. In case no abnormality is found, then barium swallow with videofluoroscopic swallowing assessment is indicated to detect motility disorders. In few cases, esophageal manometry is required. Now let's shift to our second topic, which is dyspepsia. This is a picture of a patient with dyspepsia. Dyspepsia is the term used to describe symptoms such as bloating and nausea, which are thought to originate from the upper gastrointestinal tract. There are many causes of dyspepsia, including some arising outside the gastrointestinal system. Dyspepsia affects up to 80% of the population, and many patients have no serious underlying disease. Patients who present with new dyspepsia at an age of more than 55 years or younger that are unresponsive to the treatment require investigation to exclude serious disease. What are the causes of dyspepsia? To make it easier to understand, let's divide these causes into categories. 1. Dyspepsia due to upper gastrointestinal disorders. 2. Dyspepsia due to gastrointestinal disorders. 3. Due to systemic diseases. 4. Dyspepsia due to drugs. And 5. Dyspepsia due to other causes. Now let's take each of these categories and talk about it separately. What are examples of upper gastrointestinal disorders that cause dyspepsia? 1. Peptic ulcer disease. 2. Acute gastritis. 3. Gallstones. 4. Motility disorders. And 5. Non-ulcer dyspepsia and irritable bowel syndrome. Now let's talk about the gastrointestinal disorders that can cause dyspepsia. These include 1. Hepatic diseases such as hepatitis, metastasis. 2. Pancreatic diseases such as pancreatitis, pancreatic cancer. 3. Colonic carcinoma. What about the systemic diseases that can cause dyspepsia? 1. Renal failure. And 2. Hypercalcemia, which is an increase in the calcium level. As we've mentioned, that drugs can lead to dyspepsia. What are these drugs? 1. Non-steroidal anti-inflammatory drugs. 2. Iron and potassium supplements. 3. Corticosteroids. And 4. Digoxin. Now let's talk about the other causes that can lead to dyspepsia. 1. Alcohol. 2. Psychological, like anxiety, depression. Now that we've talked about the different causes of dyspepsia, it is important to know what are the main alarm features that can appear in a patient with dyspepsia. What are some of these alarm features? 1. Weight loss. 2. Anemia. 3. Vomiting. 4. Hematemesis and/or melena. 5. Dysphagia. And 6. Palpable abdominal mass. Now let's try to understand together the algorithm for the investigation of dyspepsia. First of all, a patient with dyspepsia comes to you. Does he have any alarm features? If yes, then you send him for the endoscopy. If no, then you have to know if the patient is more than 55 years old or less than 55 years old. In case that the patient is more than 55 years old, you send the patient for endoscopy. In case that the patient is less than 55 years old, test for H. pylori. If the test for H. pylori is positive, then H. pylori eradication. After the H. pylori eradication, if the symptoms resolve, then no follow-up is needed. In case that the H. pylori symptoms persist, then endoscopy is required. In comparison, when the test of H. pylori is done, if it's negative, treat symptomatically or consider other diagnosis. Thank you for watching and looking forward to see you in the next video with a new topic.